Okay, good morning everyone. My name is Dao Sin and I'm the dietitian from Changi Hospital. So today I'll be talking to you about nutrition and breast cancer. What I'll be going through today is common cancer and diet myths and also diet and exercise guidelines for breast cancer survivors. A regular healthy body is able to store nutrients, conserve energy, and regulate its metabolism. When we have cancer, the growth of cancer can interfere with such usual body processes. It deprives the body of its normal reserves and produces hormones that accelerate weight loss regardless of how much is eaten. The side effects of cancer treatment can also affect intake during the treatment process. Alright, so today I'll be talking a bit more about common cancer and diet myths first. So some people have asked about soy products and breast cancer. The claim is that soy can cause cancer to grow faster or recur as it contains isoflavones which have estrogen-like activity. However, that is not true. In fact, actually, there are new studies that have found that eating soy in moderate amounts do not increase the risk of cancer recurrence and does not show harmful interaction with anti-estrogen medications. They actually found that eating food containing soy may be linked with better survival after breast cancer. Hence, it is recommended that you can include soy as part of your healthy eating pattern. How much soy should we include in our daily intake? It is recommended about 2 to 3 servings of soy every day. So this roughly equates to about 35 to 100 mg of isoflavones a day. Of course, depending on the different type of soy foods that you are eating. And it's also recommended to choose traditional soy foods rather than pill supplements. So for example, this can be soy milk, it can be edamame beans, tofu, tempeh. These are all good sources of isoflavones. The next one I want to talk about is organic foods and cancer. So there is a claim that organic foods are more helpful as they are less exposed to chemicals and higher in nutrient content. Actually, there is no evidence that organic foods is safer or more nutritious compared to your other types of foods. And there's actually no evidence in humans that say that organic foods are more effective in reducing cancer risk, recurrence, or progression. Organic foods also tend to be a lot more expensive as well. All right, the next topic I talk about is alkaline diet and cancer. All right, so alkaline diet, it is basically a diet which actually limits the amount of acidic food. So acidic foods, for example, are beef, poultry, dairy products. All right, because there is a claim that this is toxic to the body and increases the cancer risk. But the fact is that when our body, our kidney function is normal, our body actually maintains our blood pH balance regardless of the food that we are eating. Right? There is no evidence to support effectiveness and safety of this diet in humans. And if you do follow this guideline to avoid acidic foods like your beef, your poultry, your dairy, your diet can actually be very deficient in a certain sort of nutrients such as protein, calcium, and vitamin D. All right, how about sugar and cancer? Right, there is a claim that sugar causes cancer or sugar actually feeds your cancer. All right. The fact is that all our cells in our entire body, whether they are cancerous or not, use glucose or sugar for energy. Our body does not pick and choose which cells get what fuel. Right? It is not a known risk factor for cancer. However, eating too much sugar can lead to weight gain, and being obese or overweight is a risk factor for cancer. How about any sort of dietary supplements, and does it have to do with cancer? Do we actually need to have all these dietary supplements to help us, right? We try to still meet our nutritional needs through foods instead. Dietary supplements can be indicated, for example, when you do have a nutritional deficiency, for example, osteoporosis, where you need to take some calcium tablets that have been prescribed by the doctor. Currently, there is no evidence that dietary supplements can reduce the risk of recurrence or improve survival. All right, high dose of such supplements may interact also with your chemotherapy drugs and reduce effectiveness of your treatment. How about the vegetarian diet? Vegetarian diet consists mainly of foods from plant sources such as your grains, your nuts, fruits, and vegetables, and there is a claim that it actually prevents recurrence of cancer. Right? Currently, the fact is that there is no evidence of additional benefits of a vegetarian diet as compared to a high fiber and moderate protein diet that is well balanced in terms of there's some poultry, there is some meat, some dairy products included. If you do want to go on a vegetarian diet, it has to be well planned, as a vegetarian diet puts you at risk of certain nutritional deficiencies such as protein, vitamin D, B12, zinc, calcium, and iron. Right, so today we're talking more about diet and nutrition sort of guidelines for breast cancer survivors. The World Cancer Research Fund and the American Institute for Cancer Research do have continuous update projects to investigate and look at the links between diet and nutrition and cancer. Currently, the evidence is still not strong enough to make specific recommendations for breast cancer survivors. However, there are some indications of links between better survival after breast cancer and a healthy body weight, being physically active, eating foods containing fiber, eating foods containing soy, and overall a lower intake of total fat and in particular saturated fat intake. You can also go to this website if you want to find out more about this. So diet may play a role in surviving a breast cancer diagnosis, and there are also relatively few studies on diet and survival after breast cancer. These studies do indicate that women who eat more foods containing fiber, both before and after diagnosis, may have a lower risk of dying from breast cancer, and breast cancer survivors who eat more foods containing soy after their diagnosis may have a lower risk of dying from this disease. Women containing a diet high in fat and saturated fat before developing breast cancer may also have an increased risk of dying following the diagnosis. Of course, there is more research needed to investigate these links in order to confirm whether these foods do affect survival after breast cancer. All right. They do have certain guidelines as well. So maintaining a healthy body weight, being physically active, having a diet rich in whole grains, vegetables, fruits, and beans, limiting consumption of fast foods and other highly processed foods that are high in fat, starches, or sugars, limiting consumption of red and processed meats, limiting consumption of sugar-sweetened beverages, limiting consumption of alcohol, and not to use dietary supplements for cancer prevention. Right. So some tips for breast cancer survivors. One is actually to maintain a healthy body weight. Two is to consume a diet rich in whole grains, fruits and vegetables, beans as well. All right, focus on your healthy fats, limit your sugar and alcoholic intake. What is a healthy weight? So usually we use this BMI to monitor our weight. So BMI is basically your weight over your height times to the square of your height, and it actually has been shown to play a role in occurrence of cancer and possibly the recurrence of cancer. The American College of Sports Medicine, they do have some recommendations for physical activity. So they do say to avoid inactivity and return to normal daily activities as soon as possible after diagnosis. Aim to exercise at least 150 minutes per week of moderate intensity exercise or 75 minutes of vigorous intensity exercise. So what are moderate and vigorous intensity exercise? I will go through in a bit. So moderate intensity activities could be, for example, brisk walking. It can be like gardening. It can be ballroom or line dancing. dancing. So a general guideline is you can talk but you can't sing. So you're breathless enough such that you can't sing, but you are still able to maintain a conversation. Right? So for vigorous activities, so this would be, for example, biking. It can be fast dancing. It can be, for example, jogging or running or swimming fast, swimming laps, tennis. So generally, this is, for example, when you're doing these activities, you can only say a few words without stopping to catch your breath. So also having a diet rich in whole grains, fruits, vegetables, and beans, right? We recommend having a variety of fruits and vegetables in our daily intake, right? Having more beans and some legumes as well. Choosing whole grain products whenever available. For example, this can be wholemeal bread, crackers, cereal, brown rice, chapati, and oats. So example of one serving of fruit is, for example, a small apple or orange, a wedge of papaya, pineapple or watermelon, or if you're talking about grapes or longhans, about 10 pieces each. So we do recommend having about 2 servings a day of each of fruits. All right. So in terms of vegetables wise, roughly it would be about 3/4 mark of cooked leafy vegetables or non-leafy vegetables. All right. If you're talking about raw vegetables, it would be about 150 grams of that. Or if you're talking in terms of your plate wise, it's about 1/4 serving. All right. We do aim to include 2 servings of vegetables in our daily diet. Example of a serving of whole grain would be 2 slices of wholemeal bread, 4 pieces of plain wholemeal crackers, 2 wholemeal chapati, half a bowl of whole grain noodles, bihun or spaghetti. We do aim to have about 5 to 7 servings a day of these foods. Alright. For beans and legumes, one portion of it would be about 3/4 cup. So this can be, for example, your peas, can be your beans, baked beans, lentils. These are all some examples. Right. How about other dietary considerations? So just now we did go through a bit about soy as well. So it has been shown that it does not increase the risk of breast cancer recurrence, and it does not show harmful interaction with anti-estrogen medications. It also has been shown that eating food containing soy may be linked with better survival. Alright, how about the other thing that we want to consider is calcium, which is an important nutrient for bone health and for prevention of osteoporosis. Do recommend to include 1 serving of calcium-rich food every day. This would be, for example, your milk, your dairy products such as your milk, your calcium-fortified soy milks, yogurts, fish with edible bones, for example, your sardines, your ikan bilis, green leafy vegetables, and calcium-fortified foods, for example, breads and biscuits. Right. Example of half a serving of such foods would be 1 slice of cheese, or 1 glass of low-fat milk, or calcium-fortified soy milk, or 1 small tub of low-fat yogurt, about 150 grams of that. We do try to focus on healthy fats, limiting our intake of fried foods, savory snacks, and fast food, and also limiting our intake of red meat and processed meats. We do know your different types of fats. So saturated and trans fat, we do try to limit this. This would be, for example, your fats and skin on meat, butter, lard, ghee, coconut oil, palm oil. Right. Your trans fats would be, for example, your processed snack foods, your keropok, your potato chips, fast foods, all this sort of goods. Unsaturated fats, the polyunsaturated and the monounsaturated, these are the ones that are healthier for our heart as well. So this will include your oily fishes such as your sardine, your mackerel, your salmon, vegetable oil such as corn, soybean, sunflower, safflower, olive oil, canola oil, peanut oil, sesame oil, your nuts, seeds, and avocado as well. Alright, so some practical tips on how we can limit our bad fats and try to include more of these good fats in our daily diet. One would be to remove excessive fat and skin from meat, especially when we are eating outside or at home as well. Right, limiting intake of fried foods, savory snacks, fast foods to no more than twice a week. Limiting coconut-rich dishes to once a week. Right, aiming for 2 servings of oily fishes twice a week. For example, this will be like tuna, mackerel, saba, salmon, using healthier oil in cooking as well. Generally, we aim to eat for less than 5 servings of red meat per week. So one serving of red meat roughly is about one cut deck, that kind of portion, which is about 90 grams of cooked meat. We do try to limit our sugar intake as well, so avoiding sugar-sweetened beverages, trying to choose water as our main choice of beverage as much as possible, choosing beverages with no or less sugar, asking for less sugar, less syrup in your desserts, and using the sugary spreads such as jam, kaya, and marmalade sparingly. So generally, we aim to limit our intake to less than 11 teaspoons a day. Right. So how about eating out at hawker centers? So some practical ways that we can help to reduce our intake of sugars and also fat would be, for example, instead of having a roti prata and teh tarik, it can be something like a thosai with a teh o siu dai. From nasi lemak, instead of nasi lemak, we could have like economic rice with meat and vegetables, and also have a piece of fruit on our side as well. Right? Instead of like fried noodles, mee goreng, chendol, we could also choose to have something like a noodle soup in clear soup, and also dessert soup that is not coconut milk based, for example, sweet potato soup. Right? So for cancer prevention, it is recommended that it is best to avoid alcohol. So if you do want to drink alcohol, no more than one standard drink per day is recommended. So this roughly is equivalent to 1 can of regular beer, half a glass of wine, or 1 shot of spirits. So my healthy plate model does show a better visual guide as to how your plate should be looking like for a more balanced sort of diet. So filling half the plate with fruits and vegetables, a quarter of it with whole grains, your rice, your noodles, your bread. The other quarter can be filled with meat, fish, tauhu, the protein foods, and also using healthier oils, choosing water as a choice of beverage, and also choosing to be active. So this, for example, can be how it looks in terms of practical, like a visual guide for you. All right. So there is no specific foods, diet, or supplements that have been scientifically proven to cure cancer based on all the research that is going on in the past and currently. There are also many unproven alternative dietary treatments which often are overly restrictive and do not provide enough calcium, calories, and protein, and can also cause nutrition deficiencies in terms of important nutrients such as calcium as well. All right. So before taking up any sort of diet that you might see online or somewhere else, think about how does this diet affect your weight? Does it interfere with your medical treatment? Are there side effects or risks? And does it claim to have unrealistic results? All right, thank you very much for your time.